Hi everyone, my name is Urvi Thanekar and I am a first year PhD student at the Institute of Health Transformation within Deakin University, Australia. This research project is a poster is a part of my master's thesis, which looked at local government stakeholders' perceptions regarding food environment policy actions to simultaneously influence climate change and healthy eating in Victoria, Australia. So, unhealthy food systems are a key driver of diet-related burden of non-communicable diseases. They also account for 30% of the global emissions. Local governments can play a crucial role in improving the healthiness and environmental sustainability of food systems. However, it is currently unclear what they can best do in this space. Our aim with this study was to explore Victorian local government stakeholder perceptions of policy actions to simultaneously address healthy eating and climate change via food environments. We employed a qualitative research methodology and we used purposeful sampling strategy followed by an informal snowball sampling technique to recruit stakeholders from Victorian local governments. It was targeted to recruit stakeholders from both urban and rural local governments from a higher as well as lower CFA decile. In-depth semi-structured interviews were conducted via video conference, and data were analyzed using reflexive thematic analysis using an iterative deductive approach. This was guided by the elements of the multiple streams theory. So the problem, policy, and politics stream of the multiple streams theory was used to guide the data analysis. Coming to the results section, we conducted 11 semi-structured interviews from 4 local government settings from a lower and higher CFA decile. 2 of the local governments were from urban regions and 2 of them were from rural regions. We found out that local government stakeholders did acknowledge the council's role in undertaking actions to simultaneously influence healthy eating and climate change. Stakeholders identified key action areas such as community gardens, food procurement, availability of fresh food in retail, and urban land use and design as opportunities for policy action. The policy actions are summarized in the figure 1, as we can see. Stakeholders also had varying views about certain policy action areas such as community gardens as seen from the research poster. We also found that executive agendas, competing priorities, and social health inequities were barriers to policy action. And lastly, food security and managing impacts of climate change were highlighted as future action areas. We discussed that stakeholders can enable policy change by tailoring policy action areas according to community needs with help of external partnerships and executive support. For favorable policy action, we recommend operationalizing the elements of the multiple streams theory to increase the stakeholder perceptions of problem significance, prioritize solution feasibility by policymakers, and maintain political environment conducive to policy change by leveraging community and executive support from within the council. Thank you so much.